Good afternoon and welcome to January's Lunch and Learn. I hope everyone is having a wonderful start to the new year. I wanted to take some time today and talk a little bit about family leading the way and what it means and why sharing our story is such an important job of being a parent leader. I've heard a little bit about some upcoming changes that may or may not be coming to grants and different policies, but the rumor is that family voice is really going to be pushed back to a lesser scale. And we have worked so hard for what we do already. So having it pushed back could and probably would potentially set us back instead of doing all this really strong work and all the great things that we're already doing. So I just want to remind everyone why family engagement is so important. So if you ask a family who's kind of new to navigating mental health systems, what it's been like, these are some of the words that you may hear. Feeling a lot of shame or helplessness, being blamed, a lot of anger, a lot of stigma, maybe a lot of feeling like they have to stay quiet, that they're not worthy of help, that they're being misunderstood. So sharing our story is this really powerful tool that both on the parent and caregiver side, and even for youth, sometimes I feel like when a youth shares their story, it may be even more powerful than when parents do. We've had a really long journey, and there's a lot of things that we've fought really hard to make better. So, some of this is that, again, youth just have a different set of needs and experiences than the rest of families. And as parents and caregivers, we also have a very different set of experiences than adults who live with their own mental health needs and the system that they go through. Sometimes, if you have your own needs, it's a little easier to navigate because you're the one feeling this and you're the one going through it. It's definitely harder for parents and caregivers because everyone kind of has to take our word that we know this is what our child's doing. And sometimes for youth or young adults, they feel like people aren't taking them as serious as they would like to be. And these are a lot of reasons why sharing our story and having family engagement is so important. And again, families feel blamed and shamed for what they are going through. That stigma is very real, and families and youth feel it all the time. And again, parents, caregivers, and even young adults are this untapped source of peer leadership. We've been through a lot. We don't want anyone else to have to go through these things. I'm sure many of you have heard me say before, no one should ever ride the struggle bus alone. So looking back on the progress that we have made through our hard work, um, due to a lack of involvement and parents feeling blamed and tired and angry and frustrated. They started meeting at the kitchen table. So this is kind of how these organizations got started, is they were finding ways to meet and advocate for each other and for themselves, and just doing it with amongst themselves without a big organization. So family organizations were formed, this including NAMI, Virginia, and then Virginia Family Network, Youth Move, and the Federations of for Family of Children's Mental Health. The Child and Adolescent Service System program began in 1983. And then starting in the 90s, the system of care began introducing concepts of care being child-centered and family-driven. As family organizations and systems of care communities have began to establish, so youth groups and youth organizations organically started. So over time, partnerships between families and systems have evolved from being controlled by professionals to partnerships with families and youth to, again, only professional services, to being able to pull in these natural supports to help families, to help youth, having multiple case managers and all kind of having a different idea of this is more important. No, this is more important, to having one care coordinator who kind of is able to help everyone get on the same page and work together. Again, lots of family blaming to now having family partnerships. We're working at the table. We're part of these treatment plans. We're part of the overall plan of what is going to happen. There was a very deficit model. It was, well, this isn't good enough. This isn't strong enough. This isn't right, to a strength-based model. So these are all the things this family's doing really well. So let's work off of that. Let's encourage that to continue. And then a monocultural idea, this is the way it is, and this is just the way it is, to cultural competency. Now we understand not every family is the same. Not every family runs the same. There is a big difference between a family that has two parents to a single parent family. There is different in the way a family is working because of their religion, because of their race, because of their ethnicity, because of the way they identify, because so many reasons. And all of that is now being taken into consideration. These changes to include family and youth involvement have increased the success when providing care. This has become because families and youth know what works for them. They know what they've tried. They know if it's what they feel is going to be helpful. Um, Families know their limitations. This is definitely when you feel, if they're already out of the house for multiple appointments a week, are they going to want to do one more outside of the house appointment? This can also be the reverse of that. If they have multiple people coming in the house a week, do they really want one more person coming in the house? Do they ever feel like they have time to try to just work as a family? So they know what's going to work for them. Families and youth keep track of their services. So they know, yes, we've tried this. No, we haven't tried this. We tried this, it didn't work. This is why it didn't work. So you're not always just spinning your wheels doing the same things over and over. And when you're involving youth, there is a level of comfort and trust that is necessary for there to be success. So if you let youth and young adults have a say, this comfort and trust is going to be built a lot quicker because they're going to feel like their voice is being heard. And even if you don't use their ideas, just acknowledging that they have a say goes a really long way. So we talk about inclusion of family driven and youth guided care. So many parents and caregivers now share their stories because of this inclusion of family driven care. Many families have been able to become part of policy groups and advisory boards, being able to share their story. They're on policy committees. Um, so there are also numerous employment opportunities now where sharing your lived experience is the focus, or at least one of part of that job, is being able to share what you've been through, what helped your family, and letting other families know you're not alone and we can work this out and find out what works for your family too. So some of these positions include family support partners, peer recovery specialists, family liaisons, and more. So family involvement has really grown over the years. It used to be that having a seat at the table was the most a family could ask for, or a parent caregiver who really wanted to try to affect policy change. So, through the hard work of parent leaders and advocates, many changes have been made. So, we would have started in the smaller circle where it's family involvement. Again, you're at the table, but we don't really want you to say anything. You're checking a box for us. We needed so many parents here, and that's good enough. Eventually, because we know we're going to end up saying stuff, we want to be heard. They're going to start listening to us. So we're going to have some engagement. So at some level, we're going to be able to start really engaging with these other systems. They may not always take our ideas as the route they want to go, but they're listening and their thoughts are kind of being changed. Like, at least there's enough consideration that they want to listen to us. And yet, we might not have the whole plan. We might not have the whole policy that's completely a way we would have thought it could be, but at least we're being heard. So the biggest circle is when things are family driven. That means we're leading the way, we're making the decisions, and as parents and caregivers, as the youth, that we are not only being heard, but our way is the way that it's going to be. So now families are being asked to join work groups, not just because of a number, but because our lived experience and what we have to say really means a lot. So again, because of this lived experience, they're like, we want parents, we want to know what they have to say. We want it to make the most sense for families. Policy is directly being affected by us. So we're there, we have a say, and they are understanding that if we do it this way, it'll affect families in this way. So this would be beneficial to families, then that's the way we're going to do it. Or that's not going to be as strong of a outcome for families, so let's find a better way. And as always, parents and caregivers and young adults have an ability to offer a really unique perspective of why these things are going to make so much more sense and be more effective for us. So sharing our story is so important, and I feel like I say this all the time, and I've said it many times just in this presentation alone, but it's so, so important. Our stories of our families is really what changes, and it really creates this connection. So when we're sharing our stories, we're deepening an understanding of the issues, and it's putting a face to a name, but it's also putting a face to a problem. So when they're going in there and they're like, this is the problem, they know who it's affecting. It's not a nameless thing, it's not made up anymore. Sharing your lived experience with other parents also creates valuable connection and support so others know that they're not alone. Having a child with mental health needs can be very isolating, but to know that you're not the only one out there gives you a little sense of relief, and that there's more people to talk to and to share your thoughts with, to get more resources from, to have ideas to talk about. I've had many people tell me that since they've been part of Virginia Family Network, just having someone to talk to has meant so much, but also when you're not sure what steps to take next, having someone who's, well, this worked for me, and it at least gives you a direction to go into. So now when families are So now when you ask families, what is it like working with providers and systems who consider you to be part of the team? You're going to hear words like, it's really hopeful. I feel included. I feel understood. I'm encouraged. I'm empowered to be a leader, to do more, to bring this to my community. And these are all the great things that we're already doing and helping others know that they're not alone. If you're new to Virginia Family Network and you would like to learn more ways to become a parent leader, to learn how to effectively share your story, if you are looking for somewhere to connect because you are looking for some more resources, I'm going to put my email in the comments, and we can really start having these conversations and help getting you connected with other people who can either share their story with you or help getting you towards the resources that you need to help. Um, or again, if you wanted to be able to bring things to your community, then we can work on what next steps of that may look like. I want to thank everyone for joining me. And as always, if you have any questions, if there's anything you would like to know, you can either put them in the comments or again, reach out to me. I want to again thank everyone for joining me, and I hope you have a wonderful rest of your week.